What if I told you that some of the biggest mistakes you make with your teeth happen right after you brush them? Yes, I'm serious. Today, we're revealing the dentist's secret. 7 shocking truths about your teeth you were never told. And trust me, Dr. Esma has seen things that would make your toothbrush nervous. Stay with us, because one of these truths might completely change how you care for your smile tonight.
Rasim, you're not exaggerating. Most people think cavities are the biggest problem, but that's just the surface. There are hidden habits quietly damaging enamel, gums, even jaw health. And the scary part, they feel completely normal.
So if you believe you're doing everything right, this episode might surprise you. Ready for the first truth, Dr. Esma? Alright, Dr. Esma, let's talk real life. Someone wakes up, rushes to brush hard because they think harder means cleaner, skips floss because they are late, grabs a sugary coffee on the way to work, and feels proud for brushing twice a day. Sounds responsible, right? But you were saying that routine could secretly be damaging their teeth?
Exactly, Rasim. Brushing too hard can wear down enamel. Skipping floss leaves bacteria between teeth where cavities love to hide. And that sugary coffee? It feeds acid-producing bacteria for hours. The damage is slow, silent, and painless at first. That's why people are shocked when I show them early erosion or gum recession.
So the scary part is not what hurts, it's what doesn't hurt yet. That's unsettling. Okay, this is where it gets serious. Dr. Esma, people think it's just a little bleeding, or my teeth are a bit sensitive. They ignore it because life is busy. But what actually happens if those tiny signs are brushed off for months or years?
Rasim, small symptoms often signal bigger processes. Mild gum bleeding can develop into gum disease. Early enamel erosion can turn into deep sensitivity or fractures. I've seen patients who ignored slight discomfort, only to need complex treatments later. The mouth does not isolate problems. Infection and inflammation can affect overall health, including the heart and immune system.
So what feels minor today could shape your health years from now. That changes the perspective completely. Dr. Esma, give us some perspective. How common is this? Are we talking about a small group of unlucky people, or is this something happening quietly to millions?
Rasim, gum disease alone affects a significant portion of adults worldwide, and many do not realize they have it in the early stages. I remember a patient in his 30s, athletic, no major complaints. He only mentioned slight bleeding while brushing. When we examined him, we found early bone loss. He was shocked. He thought bleeding was normal. After simple but consistent changes, we stabilized the condition.
That is eye-opening. So even healthy, active people can miss the warning signs if they assume everything is fine. Alright, Dr. Esma, let's go deeper. From a science perspective, what is actually happening inside the mouth when people think everything feels fine? Because if there is no pain, most of us assume there is no problem.
Rasim, bacteria form a biofilm called plaque within hours. This biofilm produces acids that weaken enamel at a microscopic level. You will not feel it immediately because enamel has no nerves. At the same time, toxins from bacteria irritate the gums, triggering inflammation. Chronic low-grade inflammation can slowly damage supporting bone without dramatic symptoms.
So the real battle is happening at a level we cannot see or feel. That makes regular care and checkups sound less optional and more essential. Alright, Dr. Esma, enough suspense. Give us the practical roadmap. If someone watching right now wants to protect their smile starting tonight, what are the exact steps they should follow?
First, brush gently for 2 full minutes with a soft bristled toothbrush. Pressure should massage, not scrape. Second, floss daily to disrupt plaque between teeth where brushes cannot reach. Third, limit frequent sugary drinks and rinse with water after consuming them. Fourth, schedule professional checkups and cleanings consistently, even if nothing hurts.
So it is not complicated, it is consistent. Small daily habits, repeated correctly, protect your future smile. Before we wrap up, Dr. Esma, let's make this crystal clear. What are the biggest don'ts people should avoid starting today? Because sometimes what we stop doing matters just as much as what we start doing.
Great question, Rasim. Do not brush aggressively. Force does not mean effectiveness. Do not ignore bleeding gums. They are a warning sign, not normal. Avoid constant snacking on sugary or acidic foods throughout the day. And please, do not skip dental visits because you feel fine. Early detection prevents complex problems.
So gentle brushing, daily flossing, mindful eating, and regular checkups. Simple rules, powerful impact. Your future self will thank you.